Hi everyone, my name is Calvert Tisdale from University of Queensland Labs Research Group, and today I'll be presenting my abstract, Utilising data linkage to describe and explore mortality among a retrospective cohort of individuals admitted to residential substance use treatment. Including myself, this paper also involves Dr. Dominique D'Andrade, Dr. Jenny Lung, and Professor Leanne Hyde. I have no conflict of interest to declare, and among other acknowledgements, I'd like to highlight Lives of Well for providing funding and in-kind support for this project. So a common response for individuals with moderate to severe and complex substance use disorder is treatment within an inpatient residential facility. However, despite residential treatment being a very common option for substance use disorder, the outcomes are often unknown due to the hard to reach and vulnerable nature of those who access these services. Data linkage is a novel method that can be used to access data on this population, which precludes the barriers that are often encountered with this population, such as poor follow-up due to high attrition. Our cohort consisted of 1,056 individuals admitted to 3 residential treatment facilities across Queensland, Australia, from January 1st, 2014 to December 31st, 2016. This cohort was linked to the Queensland Death Registration Data and Cause of Death records from the Australia Coordinating Registry. We found within this cohort that there was an average of 45.5 years of potential life lost. And we also found that alcohol was a principal drug of concern for those who died, with over half using alcohol as a primary drug. We also observed that suicide and overdose were the most common causes of death within this cohort. What this says is that the avoidable nature of these deaths within this cohort highlights the need for continuing care following discharge from residential services. Further administrative data, such as whether they access further alcohol and drug treatment following discharge from a Lives of Well facility, or whether they encountered acute health services. Presentations such as this would allow us to paint a better picture of the factors surrounding preventable death and whether protective or risk factors were present. So the key messages of my presentation today are that this study highlights the need for follow-up after discharge from residential treatment, and also that data linkage has the potential to investigate risk and protective factors for poorer outcomes of this hard to reach population. If you have any questions, please feel free to email me. Thank you.